So thank you so much. લંચ પછી અને છેલ્લા સેશનના છેલ્લા ટોકમાં બધાની હાલત આપણે સમજી શકીએ છીએ. But first of all, congratulate all team of RSSDI Gujarat chapter organizing committee for wonderful talk. I will start by saying કે સવારે જ બંસી સરે આપણને કહ્યું કે પંપ એનાથી લાઈફ બદલી શકાય છે. Sir again convince us that CGM is very very useful. We can do tremendous lifestyle modification and we can reverse the diabetes. And Dhruvi also convince us that if we use that data in a meaningful way, we can change lives of many people living with diabetes, whether they are type 1 or they are type 2. But let me go through the subject that, can I have my slides? That is a tech and teen. I take this topic, मैं ध्रुवी ने topic को तने कहूँ तू मना topic है because I am struggling with this. I have 2 kids at my home, they both are teenage. અને ટીનેજના ટેન્ટ્રમ સમજવા, એમના ઇમોશન સમજવા, એમની વાતો સમજવી અને એમનું ટેકનોલોજી પ્રત્યેનું આકર્ષણ અને અપાકર્ષણ. The thing that attracts them the most this month, the next month the thing will be different. And when we are talking about type 1 diabetic population, જ્યારે ટીનેજના છોકરાઓને એક્ઝામ વખતે એક્ઝામમાં શું લખીશું, કેટલો ટાઈમ વધશે એનું ટેન્શન હોય, the type 1 had that tension that whether they will get hypoglycemia or not, એનું સેન્સર વિઝિબલ છે કે નહીં, અને સેન્સર વિઝિબલ છે તો આજુબાજુના લોકો મને શું કહેશે. So that stress is tremendous. So tech and teens that I am going to talk today. In type 1 diabetic, all the age group have their own troubles, but adolescent is a very separate age group because of their hormonal changes, because of their rebellious nature, and because of many recreational activity, including drugs, alcohol, and sex. So these are some adolescent unique challenges, psychological issue. They are going to win the world. એટલા બધા હોર્મોનલ વાવાઝોડું હોય કે દુનિયાને મુઠ્ઠીમાં કરી લેવી છે અને બધી જ વસ્તુને બદલી નાખી છે. યુવાની એ થનગટ મારતી હોય, that psychological issue માં તમે એને બહુ ડિસિપ્લિનથી ડાયાબિટીસ કંટ્રોલ કરવાનું કહેશો. They will either not do sugar regularly, they will skip the dose of insulin, and that will hamper the management of their diabetes. Lack of therapeutic adherence, inappropriate dietary habits, પાર્ટીસ થતી હોય, એક્ઝામ પછી એક્ઝામ પહેલા કઈ બહાર જવા આવવાનું થયું હોય, સ્ટ્રેસ રિલેટેડ ઇશ્યુઝ, પુઅર ફિઝિકલ ફિટનેસ. They are now the youth of India are getting obese, and that is also trouble because in teenage also there is a sleep irregularity, there is the cases of insulin omission, and also we must say that substance abuses are maximum in that age group. So this is a picture of our teenage in this era that they are surrounded by their computers, their laptop, their iPads and what not, and they are eating a multiple kind of junk food that hampers their diabetic control. And what we have to do as a parent or as a doctor, we have to educate them the importance of technology, because whatever good technology is, if they are not used in a proper way, as Dr. Booth sir said in the morning, that we are the parent of the technology, we are not slave of the technology, so we must use them in a proper way. This is a paper from Chicago where doctor says the technology can reduce HbA1c up to 1% in type 1 diabetic population. But again in NHS they say the type 1 diabetic will not accept your decision for their decision. So no decision about me, without me was a paper, white paper at the NHS. Now let me again go through some data that shows that using insulin pump, closed loop pump, that will help to control the blood sugar. But in teenage, the data found that they use this device as a reactive. Once their blood glucose control is lost, then they use the technology to control it. Rather than it should be other way around, they should use this technology to control proactively. Again, transition age, patient with type 1 diabetic from transition to childhood to early adulthood to teenage and teenage to puberty, the use of technology will help them for a better and good transition. Improve metabolic control, not only glycemic control, their CGM will also help them to help improve metabolic control as well. And CGM may also reduce perceived diabetic distress. Diabetic itself is a distressing situation, and doing SMBG multiple times, taking 5 to 7 shots daily will cause multiple distress. But using CGM and pump help to reduce the distress in them. This is a wonderful study in which multiple young age children were given pumps and they were observed, and they found that early use of insulin pump for 6 months after the diagnosis will help them to achieve good glycemic control, and after 3 years also post diagnosis the control was really good. Again, this data shows cost effectiveness. Yes, as Dr. Dhruvi said, cost is an issue for India, but when we see long term picture, Dr. Bansi sir said in the morning that not more than 10% people live more than 30 years of age in India, and first 10 to 15 years there will be no complication, and that is the teenage or this age adolescent age group. In this time, if we use pump and CGM regularly, we can reduce the complication and mortality in the future. Again, this is one more study that advocate the use of pump in very early childhood. The parents are very anxious about using pump in this age group, but data showed that early good glycemic memory, good discipline in the children while using the pump will also help to reduce their glycemic control or having good glycemic control without having much hypos. So not only technology in terms of insulin pump and CGM, there are multiple applications like diabetes buddy, there are multiple applications that help to track their carbohydrate, insulin and SMBG. They will all help them to have good glycemic control. And there are also many other applications that are like fitness tracker that will also help them free of charge to have good control of their lifestyle. So living with type 1 diabetes is not easy, but with the use of technology, we can make them easy. With the use of social sharing, big data, AI, wearable technology, wireless technology and breakthrough technology, we can help to live them without much distress and have good glycemic control. So with that, I saved your 10 minutes because it's already 3 o'clock. Thank you so much.
Thank you.